Hey everyone, welcome back to the YMyHealth podcast. It's your co-host Melissa Schenkman here, and we're going to be talking about a topic that is of tremendous importance to people in our generation, which is colorectal cancer and the rise in colorectal cancer cases under for people under the age of 50. They've just been really going up. We hear about this a lot, and we want to know, how do we navigate our healthcare within this context? And we're very fortunate. We have wonderful partners at Fight Colorectal Cancer, which is Fight CRC for short, and they have been working on something that's really cutting edge, this global think tank. And we are so fortunate for this episode to have two of our Fight CRC partners joining us. Today, we have Dwyer, who is a member of Fight CRC's Medical Advisory Board and Head Research Advisor, and Kiran Ilagan, who is the Director of Research Advocacy. So welcome, Andy and Kiran.
Thanks so much for having us.
You're so welcome. Well,
Yes, thank
just
you.
to kind of kick off the episode, I would really like to have each of you tell the YMyHealth community a little bit about your particular roles and your work at Fight CRC.
Great. I'll kick us off because I think I'm older and been here longer, but Karen has amazing contributions, which she'll share as well. But I've been delighted to work with Fight CRC and the organization for about the last 10 years, really looking at that intersection of patient advocacy, research, and patient education. And have had a lot of opportunity to work with the CEO, President Angie Davis, in our time prior to her working with Fight CRC, but really thinking about what are the real essential research questions. And it's just been an honor through the work with Fight CRC and then my work as faculty at University of Colorado Cancer Center to really think about what are the issues that are most relevant for research as relates to the patient survivor community that we really should be tackling and addressing. And it's been a pleasure to work with the organization. Early onset, I think, is one of the biggest things in the last 10 years that has come across as really kind of an essential area of focus and should continue to be a focus for research. And so it's how I got engaged. I'm excited to be a member of the team and working with Karen.
Awesome. That's awesome. And Kiran, what about you? Tell us about your experience.
Andy said that she's older, but not older, but she has been with my CRC for longer. I've only been here for a little bit over 4 months, but not new to public health space or patient advocacy space. I've been in the public health world for about 13 years, and all of my work has always connected back to peer-led interventions or having that patient perspective always be at the forefront. So that's actually what brought me to Fight CRC. And as you had mentioned, I'm the director of research advocacy. Our research advocacy team really is just everything that falls within research advocacy. Research falls under our wheelhouse. So anything research related, but making sure that we bridge in patient perspectives to ensure that patient voices aren't just heard, but they're valued at every stage of colorectal cancer research.
Which I think is one of the most unique things. There's several, but one of the most unique things about this think tank and something we're going to be talking about today is how patient centered you have kept things, which is something that not everyone does and is so greatly appreciated. And from both of your experience, and looking at all of your experience in the colorectal cancer community, what would you say is the number one most pressing issue when it comes to research in the area of early onset colorectal cancer in particular? And Andy, if you'd like to start.
Absolutely. I think the biggest question right now is what is the why, right? The causation. The fancy term is etiology. What do we think is driving this? And, I think it's kind of been the big question since the beginning is that on some level, people used to think, hey, it's because people don't have access to screening in this young group. Maybe it's the guideline, maybe it's in a number of issues. But even as we started to identify risk, started to even look at that movement of guidelines from 50 to 45 for even the average risk population, I think we can't screen away the problem, and the problem exists. And I think until we identify the why or the whys, which I think it actually, in my opinion, I think it might be more than one thing working in tandem. I think that's really got to be the focus because we really have to figure it out for this generation, but not just even the people who are our age or even a little younger, but honestly, those who are very, very young because this is an issue and I think it's a priority.
Absolutely. Absolutely. What about you?
Yeah, that's exactly it, is figuring out what the why, and kind of adding to what Andy said is we're seeing rising cases of early onset colorectal cancer, even as overall CRC rates are declining. So that means
Yeah.
it's not just about better detection, better screening. We're really seeing an increase in the disease.
No, absolutely. And that's what I think is so shocking to so many of us is, you look and you say, okay, it's rising. It's shocking that it's rising around the country in the way that it is. And that's big news and thankfully has gotten more and more media attention as time has gone on. But then you look and you say, oh my gosh, it's rising in all these other countries too for people in our age group. What is going on? And so speaking of that, you have spearheaded this incredible initiative, this global think tank on early onset colorectal cancer. I know this was co-sponsored. There are multiple sponsors, but the two leading ones being Fight CRC and the Instituto de Investigación Biomedica de Salamanca, the Institute of Biomedical Investigation of Salamanca in Spain, Salamanca. And so what led to the initial idea to convene and develop a think tank that included research partners from around the world? And was there any particular global data that you had come across that sparked this idea?
Yeah, I'll start. So I think in 2015, 16, I think looking at events like Fight CRC's hearings and Congress ambassador trainings, I just started to look around the room and notice the faces were younger, people were younger. There was started to be some emerging data. There was an interesting paper that really did a meta-analysis to say, essentially like, hey, this isn't just older people, right? This isn't just people 50 and older. This isn't people in their 70s and 80s. The trend is starting to really grow young. So I think even in that period of time, we started to see that it wasn't just anecdotal, that the data was starting to show, this increase. And, what's interesting is about the time that that was happening, there were other countries that are considered, the more wealthy or more developed countries
Mhm.
throughout the world that were seeing this phenomenon. So parts of Europe were starting to see the increase. Parts of Australia were starting to see the increase. And so I think people started to, really take a step back and say, this isn't just a one, it's just not an anomaly. This is turning to be a growing epidemiologic issue. And so, I think that even about 10 years ago, but if you look back, and Becky Siegel from the American Cancer Society, who's one of the, premier epidemiologists and really an advocate for this work, it's even talked about there's folks that 20, 30 years ago had started to notice this phenomenon, right? But the data
Wow.
itself, really has started to proliferate over the last 10 years, right? To show that specifically in specific countries, North America, parts of Europe, and then, even into Australia, Oceania. But, I think then as we started to look at these trends, and I think some of the American Cancer Society data that's coming out of the SEER data sets, starting to show now it's not just the usual kind of partners, or excuse me, the countries and regions, but now we're starting to see the countries that are developing countries and middle income countries also starting to see these trends. And so I think, Melissa, as you were talking, it's just sort of over a period of time, the data is starting to really tell the story about what the global burden is. And it's
Mhm.
not just one part of a country, it's all, it's regions, it's country specific. And so it was really the impetus to pull together, and I'll have Kiran share some perspective as well. But, I started coming to meetings in about 2015, 16, where Jose Perea, who is part of the university team that you spoke of in Spain, he was
Yeah.
in a meeting, some early investigators. There was a gentleman out of New York, Tom Weber, who pulled some meetings, and they were starting to collaborate on this work. So I really worked with Angie Davis and said, from the advocacy community, I think in addition to these investigators and some of the folks, we really need to be a part of this. So I always laugh because this connection with Jose, right, and the
Yeah.
Fight CRC and Jose, we sat in the back of a conference center in New York City. And I always laugh because I always feel like I'm the back row bad kid, right? Like talking, chatting, sending notes, trying to figure out if I'm going to collaborate with, like, what have you. And it's
Yeah.
so funny because Jose sat in the middle of a woman who I really wanted to sit next to about a project. And so we were sending notes back and forth. And I was like, who's this man? Like, scoot over. Like, I got to talk to this And then I started listening and he presented and I presented and I was like, whoa, Jose, you are the guy we need to be collaborating. So I always laugh that with Heather Hempel, who's one of the, she's a leader in hereditary cancer. She's been great at thinking about these questions. Jose being in the middle as a global advocate and someone who 10 years later, we'd be hosting these amazing global think tanks and myself. It was like the back row big kid, bad kids at the,
I
who
love that.
actually and so, like some of these amazing partnerships, but I just say, I think we stand on the shoulders of giants. There were people who were really thinking of this work, started to identify this work, and we've just kept it going. And we're not letting this go because, as you said, there has to be priorities, and as a research priority, this is it. So it's kind of a little bit of an insight of how it kind of happened, messy like in the on the backside of things. But these partnerships they're collegial, they're academic, but they're also passionate, right? And they're real people who just want to get in and get into helping our communities so that we don't really see the impact like we unfortunately are seeing so many young people having based on this rising incidence.
Absolutely. What a great story as to how all of this came
Mhm.
together. I love it. And to your point, also, Andy, about passion. There's definitely, and I can say this personally from being at Colin Congress. There's the level of passion of the researchers, of the healthcare providers, of the patients who have become even really professional patient advocates. Like it's very tangible and it's so needed. Um, in this space, and I think that's something that makes this unique. But I was curious, what makes the global think tank specifically for early onset colorectal cancer so unique, that when you think about that in terms of other things that are out there.
I'd love to kind of kickstart us here, being that new
Or
person and kind of seeing it and like seeing it all come together as I was coming in. So the Global Think Tank was really the very first of its kind of a global convening on early onset colorectal cancer. And to be a part of the organization that was hosting the event, just you could feel how much pride there was across the group to be doing the work, but really it wasn't in boasting about it. It was really about like, okay, this is so necessary. We're all
Mm,
here together to make sure that this happens, you know? And I came in right as that the planning was um, kind of robustly getting bigger and bigger. You know, we were a couple months out from the event, so a lot was going on, and the convening itself was just so thoughtfully curated in so many different ways, like even to like who was being invited. So the people who were coming, we brought together over 70 researchers, healthcare professionals, survivors, caregivers, and advocates that were from around the world who were really true experts in the field in their own regard. So having all of these thought leaders in the same place to talk about and unpack the issues to tackle like the rising rates of early onset CRC was just truly special. And to me, what was most unique about it was the efforts that went in ahead of time to ensure that the meeting was prepared to not be a typical conference where you just
mhm,
attend, you take a seat, and you listen to traditional podium presentations, but rather it was really about being a working meeting where people were up and about, they were networking, they were talking, they were having interactive table discussions of various group sizes, having breakout sessions, and really just working together. So that's
wow.
kind of like my kudos to all the work that was happening prior to me coming. So kudos to you, Andy.
Yeah, you spearheaded this and led all of this. Yeah, tell us.
yeah, well, I will tell you, as life goes on, I'm starting to really buy into the adage that there are no accidents. So I have to tell you, I think Kiran joining the team as someone who has experience in public health but has appetite for this work, I just want to say that I think, there's young professionals and there's people who are really starting to grow everything from clinicians to bench scientists to everyone who's really joining in. And I think what Fight CRC has really like brought to the table are people who are interested but talent, right? And I'm excited because what I think is we anticipate probably by the time we have everyone a part of a collective now that we're
Mhm.
probably here in probably 25, 30 countries deep in the work. On
Wow.
game day, right in Barcelona, we had, I think, 18 of the 22, but we know that's growing. And what I really think about when I think about like what makes us unique is these are folks. And not everyone has a National Cancer Institute in their country. Not everyone has a robust infrastructure, but many of them made it a point with some support from Fight CRC and other initiatives to get there. These are people who are starting their career. These are people who are just so curious, and to take, a time where many of them flew halfway across the world, or, all the way around the world, essentially, to get to this meeting. It was essential because there, to Kiran's point, this was the first one, but what Andy Chan, who was one of our advisors, out of Boston, out of Harvard, out of the work he's been doing as an amazing epidemiologist and clinician who's funded to do this work. When I started really thinking this through about, hey, what could this look like? I was at an airport in Los Angeles, and I was like, I got to call Andy immediately. And somehow he picked up on the phone. And I was like, look, I think this is what we should do. And this was 18 months before the event, right? And he's like, absolutely. He said, no other meetings are happening where people are talking about beyond their own region or in their own community or country. We need to start opening this up in a bigger way, because here's the other thing about the science. We're seeing this increase, right? The numbers grow and we're seeing the increase. But if we're going to do the types of studies, we're going to do the type of science that has the kind of what they typically call power, right? This shows the number of people in research studies, in different sort of interventions. We have to show numbers, and being able to do that only in the United States, it does it partially, but it doesn't have the same power that it would as if we would look at this from a global perspective. And so, I think that's why this was different, is it was kind of pick up your head and say like, okay, cool. I know what I'm doing. I'm the subject matter expert. I know my community, but I'm going to connect these communities so that we can study the it in a much bigger way. And I just want to say this because I think a little bit about that idea of the passion. And I've told Kiran this story, and it still makes me really reflective to this day when I think about some of the things that ignited me. Melissa, you went to Colin Congress, seeing survivors and advocates. And I remember when I had first read the article in 2015-16, started thinking about young people in colorectal cancer. I sat at a table with 4 women who were in their 40s and early 50s. And just thinking, this is a group of women who are still pretty young, to get the disease, and sitting there talking. And, just said, oh, tell me about your diagnosis and your personal experience. Come to find out, each one of them were mothers of young women who had been diagnosed. And 2 of the 4 women had passed away, and they were 20 years old, 18 years old. And in the time since that meeting, the other 2 young women who were daughters of these ladies have passed away, and one was in hospice care at the time. And I remember the magnitude of that. And I just went to the bathroom. And at that point, these were people my age and younger, and there were 4 mothers who had lost young girls, right? And to this day, I think in South Korea, in North America, in Nebraska, in Miami, like, there's a family that's missing a daughter, that's missing a wife, that's missing a mom, right? And so I just have to tell you, I think that was also one of the things, is like seeing all of this impact in families. And even a woman who was so strongly advocating at an event to the point where, just saying, like, we have to figure out why this is happening. And I just think of the faces and the names in those people. And I just want to say that, like, to the point is, there's a kiddo who's missing a parent, someone everywhere in every country. And I think that's also like the reality of this situation.
Oh, I can totally see that. Absolutely. I know with each person that we've had the privilege of interviewing with YMyHealth and hearing their story of diagnosis and in many cases of loss, it stays
Mhm.
with you and drives the
Mhm.
work. Absolutely, absolutely. And far as the kind of what I know, you've kind of given us the background as to how this incredible think tank came together with so many global partners. What, when you were there during those days, if you could kind of walk us through what the global think tank was like in Barcelona in terms of how the meeting was structured. I know you mentioned it was not like a traditional conference where you're sitting there, because that is true that all of us and those listening, you know how that is. You walk in, you're in a session, you're in a seat, and you're going to be in a seat for many hours while other people are talking. So tell us, and you were saying it was more networking and discussions, and which sounds wonderful, but tell us a little bit more about it.
All you, Kiran, you do a
All
really good
right.
job.
I was like, I could get into like, kind of the bones of the structure, and Andy does a great job with the meat. So I'll kind of set up the stage, and maybe you can kick
Love
us
it.
off and go into like the work groups. But It was a short day and a quarter, like we like to coin it, but so it was
Yeah.
short in time, but boy, was it jam packed. So
Oh,
on day one, we started later in the afternoon, and it was basically that was that quarter day, and it was
mm,
just to kind of set the stage, remind everyone about why we were there, what to expect for that day, for the next day. We had really brief uh, global advocacy perspectives from our international advocacy partners that just talked about advocacy efforts from around the globe. So we
Oh,
had
wow.
bowel cancer Australia, bowel cancer UK, colorectal cancer Canada, um, GCCA, digestive cancers Europe, and then Fight CRC. So everybody just kind of spoke to like what's going on, what are we doing in our advocacy worlds, but that was just really brief, right? And just to be
mm,
able to hear from around the world. And then really beyond that, it was the opportunity to get to know who was in the room and what brought them to
Mhm.
join to be in the room. And that was it for day one. Day
Wow.
two, we started early in the morning, and it truly was um, that was our working day. We started with the one and only formal PowerPoint style presentation, which was from Becky Siegel, like Andy had mentioned, from American Cancer Society. And that presentation was on global data and trends. And that was really just to get us all to level set on the gravity of the current state with the most up to date statistics and findings. And then that set us up to then diving deeper into more regional findings where participants they physically got up and did a gallery walk around our conference space. So we set up stations that represented 6 areas of the world. So we had a space for Australia, a space for Africa, a space for Asia, North America, South America, and Europe. I was like, I know there's six. And we had a timer that would ping every 12 minutes. But in the 12 minutes that you were there, you were able to really just learn about what were the suspected drivers in that particular region around the world, and then get dive into a little bit about like why they're suspecting that those are those drivers. And then after that, we just split into 5 breakout groups, and I'll pass over to Andy to kind of talk us over what those five
Yeah,
groups were.
that'd be great. And I know we're gonna dive into those even further a little bit later in the episode, but yeah, please, Andy.
absolutely. And when we started really looking at those breakout groups, and I think that Kiran said we had a day and a quarter, right, to basically do a speed
Mhm.
dating. I kind of felt like it was like, oh my gosh, we're my match. We're going to make this happen, you and I. But the idea was like, this is a chance to meet, greet, with big ideas, connect the dots, make these relationships. But the name of the game is sticking together. And so those 5 groups, right, were really about what are the research priorities. And so for the big things that we could do, to your earlier point, we all agree coming to this meeting, screening guidelines and what's happening throughout the world. That's a great topic, right? Specific issues as it relates to public health and insurance and coverage for screening, great issues. But for this meeting, we're talking about etiologic drivers, right?
Mhm.
And so if we're going to study those, what are the areas that we should really focus? And so there's a dedicated group and a work group talking about that, really thinking about also really thinking about common elements as if we're doing biobanking and really looking at tissue samples and the like, making sure that what's collected from blood samples from tumor biopsies, thinking about all of the grabs we're going to do with like the blood, the sputum, whatever it might be, right? Let's do it the same way so that when we get these samples, right, we have enough of what we need to do. Everyone's clear on what it is, and we make the most of the opportunity for the patient and the community. And then setting up something that we call epidemiologic tool and a
Mhm.
specific work group around that. And that's again, really talking to meet the needs of what these research question will be. What do we need for standardization around demographic information, exposure? What are some of these other epidemiologic pieces? So those were really kind of, the ones that were ready to rock on, as I keep saying, a game day in Barcelona. But there was also a really awesome conversation that happened with the partners that Karen mentioned, right? All the advocacy
Mhm.
group who also throughout the world, I think have at least a bit of a touch with policy and funding is saying like on some level, we got to continue to keep this consortium together and keep us funded. Who's in? which I think was a large cry of everyone there. Like, we're keeping this momentum. But it's also like when we're thinking about global strategies, especially with the complexities of what's happening with our federal government in the United States, as well as complexities around the world, how are we going to advocate for funding of this research? And then, we left some space during the day to say there needs to be another work group formed. What is that work group? And we decided that risk stratification and understanding what interventions needed to be front and center, ready to roll, that if someone is identified based on risk stratification, signs, symptoms, certain genetic hereditary components, maybe other elements, how are we going to really think about identifying early interventions for the subset of people that also lend itself back to, again, that understanding of the etiology? But I think we'll talk about those, a bit further. But the whole idea is those groups, right? It's really about the perpetuity, and like, it is not just a one and done discussion like many conferences are. It's about creating this consortium. And that's really kind of the 5 groups that are going to be making up.
That's fantastic. That's absolutely fantastic. And one of the other things, and we were talking about this a little bit earlier, is that makes this so unique is you made this global think tank, in addition to all those wonderful work groups, so patient centered. And so I was wondering kind of what made you and fellow leaders, as you were building out what these days were going to look like, decide that even with this heavy research focus and figuring out, in terms of going forward research strategy globally, that it was crucial to also involve the patients.
I'll start with the planning side and have Kiran, talk a little bit about kind of the execution of those pieces. So, I
Yeah.
think early on, hearing from the research advocates that are part of Fight CRC, looking at people who are coming to all the events that we spoke of, there have been a
Mhm.
lot of opportunities to ask people, like, where do you think we should be focusing the time and the research? There have been surveys, there are gatherings, and I will just say cumulatively, this is an area where people keep saying, we have to figure this out. And what's interesting is I think there's a lot of young, there's people that are aging out of early disease,
Mhm.
but we're either that person or to see that there's lack of resources for this community that have always advocated for early onset in general. And so, of course, I think, there's some specific things related to survivorship and survivorship care, that those are things from the FICRC is doing, from implementation and advocating and policy and really thinking about education. And so I think those things fit here. But I think over time, people say figuring out this why, because we can't continue to have this happen.
Mhm.
People have really been excited about this. And what's interesting is, like, even though we have been very much involved in helping look at guideline change for the average risk population from, the 45 to 50, I think the community is starting to realize that you can't screen away this problem, like I said earlier. And I think people are also realizing that, having a standard population screening guide that starts at 20 or 25 years old, that's not the answer, right? We're not going to pick up enough to get it. So I really think hearing from the research community, educating, and then bringing this back. But one of the other things, that we did well in advance is also we've been doing survivor, basically looking at pulse surveys out into the social media realm, looking at research groups and saying, kind of what are these issues? And we really used information to say, like, to, that discussion about risk stratification is that,
Mhm.
there's some folks that just know they need timely care. But if we know that, but it's also going to help us add that, we need to fuse that in. We've had patients really look at the agendas they're involved in setting, looking at the building out of the implementation of this work. And so that was true. And those people were really included in the day, which Kiran could talk about. One of the fellow, one of the spokespeople that we've had, but she was also very much going to be integrated into the work moving forward. So I would say it's iterative, right? All the events, there's focus groups, there's surveys, there's polls. We've utilized that. And even coming into this early onset meeting, we started to do polling for a global survey that's still, somewhat in play, where we have, short of 600 respondents from around the globe, and we're getting ready and we're synthesizing that data. So that will help us with the work we're doing next. But it's always been front and center. And several very dedicated young research advocates were helping. And so, Karen, I'll let you have you chat a little bit about the young woman who was from Spain, who was
Yeah.
part of our event, but she was integral. So if you want to talk about
hmm
her, that'd be great.
Yeah, absolutely. And I mean, earlier when we were talking about research advocacy, and it's about bringing in patient voice, we
Mhm.
really wanted to to monopolize on that and bring a real patient voice to to the event space. It's
Mm,
always important to have patients be at the center of the work. So it keeps us focused on who the work is impacting and why the
mm,
work is so important. So we were fortunate to have a wonderful patient survivor who is an advocate in Spain with Digestive Cancers Europe, Mila Ogaya Toledo. And she shared her story with the group during day one. Day one, like we told
mhm.
you, was kind of setting the stage of why we're there, then going and having conversations about what advocacy groups are doing around the world. So we're hearing about all the great things. And then we
Yeah.
went off to dinner and we used that opportunity at dinner where she got up and spoke and shared her story so that then, we're hearing about, this is what's going on or this is why we're here. But it's really easy to get lost in data, right? And the stories just ensure that research reminds us and to stay focused on that this is impacting real people, not just
Mhm.
numbers of people, right? So, yeah, we had that. And like Andy had mentioned, she didn't only just come to share her story, she was involved in those crucial conversations over that day and quarter. And she was bringing in her real life lived experience. And when it came to asking everyone to commit to being in these groups for 2 years, she was one of the first people that signed and personally handed hers over. And she was so
Wow.
excited.
Oh, that's
And she's
awesome.
like, I want to roll up my sleeves. I want to be a part of this because I want to be a part of a solution for others like me. And
That's
yeah, that's her. And then we also had caregivers who were there, and one caregiver in particular who had recently lost their partner, and
mm,
that person's story was shared. I had never heard a room go so silent at the end of
mm,
that video. It
that
was a 2-minute video, and you could feel like the impact that had happened in the room. Yeah.
yeah, the voices of the patients and the caregivers are so powerful and beautifully, beautifully put. And I know you were mentioning too about the survey, the survey that's ongoing, that you had, I think, more than 500 uh, patients from 21 different countries, and you had some of that information, I believe, at the start of the meeting. But it sounds like it's still ongoing. But I was curious, with what you've seen so far, were there any results from that survey that surprised you?
I think one of the things that I'll have Karen as well, I think the fact that, that point in time when we did the analysis is that, well over 80, clearly almost 90% of people have talked about as a result of their diagnosis, they have changed their life course or career plans. And I mean, I knew it on some level. I just didn't understand how pronounced that would be. And,
Mhm.
we the granularity, right? We want to keep something pretty on topic, on point. We don't, or yeah, we don't haven't had a chance to talk with qualitatively what this looks like. But I mean, it's interesting because some of those individuals have probably, of course, as a lovely young woman who was part of Fight CRC talks about as an attorney, right? She turned her pain into purpose, right? And so there are people that have found benefit funding, right? That we talk about so often. There are people that have changed the course of a career to look different, but there are people that had to make sacrifices and decisions that they didn't want to at that time in life, right? And I think that's the one thing that hits me. And that was really globally, right? We saw that throughout the world. And I just
Wow.
think to myself, like, if that wouldn't have happened, there's definitely some, there's people that really just move and they're amazing and it's kind of the path. But I also think, like, where did this cut us short, right? And I think that was something that hit me in the gut, like,
Mm,
literally, yeah, and for everyone figuratively. And so I think that was one of the things that was interesting. I mean, I think there were some things that I saw that were really also amazing. I think there were more people than I anticipated who had been talked about, sort of making decisions about things like fertility or things
mhm,
about quality of life that 10 years ago, I don't think we would have seen that the same way, as there were a lot of people that were having chemo, radiation, and limiting things like fertility and not necessarily thinking about sexual health and function. So that was that was great. So there's some good, bad, and ugly in there. And I'm excited to see really where it goes. But, the other thing I thought was fascinating, is we also really looked at the caregiver's perspective. And
mhm,
it's going to be interesting as we look at patient perspective and then we look at caregivers' perspective. But, it's funny because a number of the caregivers who responded are females who responded based on male partners, but starting to see also a lot of the people who are survivors who are directly impacted. I mean, everyone's impacted, but if they're talking about their own experience. So even the demographics, right, of who responds to these surveys and what we can say about the population. But there's nothing quite like this in the data and the literature. And I'm excited because I think every time you put something like this out, like Kiran said, Fight CRC is about the research, but it's also informing practice. It's informing the work that we do that cross-pollinates to educate patients, but educating providers. Karen, what stuck out for you? I don't know that we talked about this in great depth, but
I know.
I'd
I
love
was
to hear.
thinking that too. And I was like, man, we're agreeing because honestly, it was like, I think the statistic was like 70% had said that, having this diagnosis had disrupted their school, their careers, their family planning. And that was a part of Mila's story in Spain. Like she was diagnosed at the age of 26, if my memory serves me right. And it all just happened so fast. And a little backstory about Mila, she's this beautiful, like, model actually, and she was getting into acting. She had an agent. She was following her dreams and getting into this career that she was starting to get a lot of traction, and then started to have some pains. And when she went to the doctor, it was just being dismissed of like, oh, it's probably period pains. It's probably whatever, and until she really like advocated for herself. And then when the process that happened, it was only a matter of weeks of when she was asked of like, okay, well, what do you want to do in terms of family planning? And she had not even thought about that. That wasn't where her mind was at all. Even, she was in the headspace of where's my career going? And now she had to totally just take a pause. And that was really, really impactful to hear from a person's own words, right? But then to hear that 70% of people also were experiencing that exact same thing, yeah, that is what struck me most. And then, of course, like we had said, of that feeling of just being dismissed, of you're too young. That's not what it is. And yeah.
Yeah. Yeah, no, that's very impactful to hear a story like that and to see numbers like that of how many people's lives are deeply affected at such a young age uh, by colorectal cancer when they are diagnosed. And in terms of the research side, which is such um, I think something not only that's so important, but also people are so curious about. We know to a degree what is happening in the US, but we probably, for most people, know very little about other countries. And I was curious, what were some of the common themes that emerged from the discussion between researchers that you have seen so far?
I'll kick it off and have Karen add as well. But I think one of the things that was we were collecting, like, as Karen described, right? What are the top drivers and where do you think we should do some prioritized research? People talked about body mass index and obesity and overweight,
Mhm.
right? So everyone came up with that. But when we got together, everyone, I think, collectively said, like, look, that's an area and that's something, but it's not just that. It's maybe that with other things, or it's putting some end caps on what do we mean by BMI and obesity and what this means,
Mhm.
because it's studied a lot. But when you look at, getting information about who these survivors are and who the young people are, a lot of that data doesn't trend to be people who are, sedentary lifestyle or have a BMI that would lead them to kind of an obese or morbidly obese category. I mean, many of these people are very fit. They're marathon runners. They're ultra athletes. So I think there was a discussion about like, it can't just be about obesity. If we do these sort of studies moving forward, if there is something about an obesity or gaining weight or a pathway, let's explore that with some of the other things. And so I think there was this one thing, and I know Karen can talk about some of the other things we heard, but I think the thing is, there was this sort of thing like with obesity example, let's stop just studying the same thing, doing same things or variations on a theme. We got to open this up because we know in our, again, the proverbial gut, right? We know that there's something more to this. And I would say that I walked out of that meeting with a lot of folks being like, let's stop doing the same old. And like, let's open up the box to get somewhere and make some progress.
Yeah, that's great to hear. Honestly, we've talked with Dr. May about that because that is one of the most common things we hear. And then again, to your point, when we interview people, none of the people we interview
Mhm.
that was not them. They don't fit that profile. So very interesting. But yeah, but what about for you, Karen?
I mean, in addition to that, like I think that that was one of the strongest themes, of course, was recognizing
Mhm.
CRC looks different depending on where you are, but it also doesn't look so different.
Right.
And so then what are those overlapping themes? Another thing that came up repeatedly was like access to care and disparities
Mm,
across um, first world countries versus third, and where younger patients they're diagnosed at later stages but they can't, no matter where you are, like they can't
mhm,
access timely screening,
right.
or that their symptoms are overlooked. And I know that we've kind of talked about this earlier. Another big thing was us really needing to look to standardize tools and look for ways that we can
Right.
connect these dots and do things at a global level so that then we can
Mhm.
have a global understanding.
That's no, that's extremely interesting, and I know we're gonna get into that shortly as well with the epidemiological logical tools. But what about um, any factors? Were there some factors that the global researchers in the room, along with the patient participants, discussed as these are the things that need to be the top priority for immediate study? What was kind of on that list that people brought up?
I think for the topics themselves, right? I think people, I would say, I think there were some discussions around understanding environmental exposures and factors and how does that fit some of the kind of established themes around nutrition and diet and some of these pieces. And so I do think how do we look at multidisciplinary approaches and how do we look at what's been done in other cancer types, what's been done in like exposure studies as it relates to etiologic work. And then I think to a certain extent, I think some of the things I've heard from this meeting and others are, utilizing some of those established cohorts that we have, at least in
Mhm.
some countries, and then growing that out, and then using some of the platforms that we have through, the prospect study that NCI and Cancer Crime Challenge. Like, how do we grow that work? How do we look at some of the consortiums that are coming and building out and adding questions? I think to some of the things that are already established, and so those are kind of some of the themes that it's like the question, but then also, kind of the vehicle to be able to get part of this work done.
Mhm.
And as we're, really on the precipice of digging in now, I think in the next 6 months, right? A lot of the ideas that are going to become most prioritized, we're going to see that come up and probably be able to speak closer to being like, this is the direction we're going because of those things I think that we heard in Barcelona.
That's wonderful to hear.
And build on when we were talking about these environmental factors and identifying like these risk factors, it was really you saw this alignment between the researchers and the patients where we really do just need to focus on um, addressing the very real barriers that people are facing. So immediate priorities are understanding kind of like modifiable risks and looking at biology earlier in life and
Yeah.
tackling like those inequities that delay diagnosis.
Makes complete sense and super interesting as well. And as both of we're so huge in the YMyHealth community about, looking at when we look at research, we like trying to explain to people what is involved with research studies because for and make research understandable and relatable because for those of us in the research fields or in the public health field, it is already, but we understand our friends and other fellow millennials who are not in that space. It's a little more complex, and so we realize there's so many ingredients that are important for creating a research study for making the study effective, and so I'd like to have each of you give us kind of a glimpse into the global perspective that you saw when you were in the working groups. I'm in Barcelona, and so I wanted to start with you, Kiran. So I know you co-led it was the epidemiologic tools group, and which for our listeners, epidemiologic tools are key to understanding and learning from research. So if you could, for our non-science, non-research friends and members of the audience, kind of give us a basic overview of epidemiology, kind of how these tools matter in research, and then share with us some of the things you learned. And I know you co-led that with Dr. May, Dr.
Yeah.
Foleman as well, who's also been a friend of the podcast and of YMyHealth.
Yes, Dr. May's a dear friend to Fight CRC, so it was such a pleasure to co-lead that with her. But yeah, getting back to your original question, like kind of breaking down what epidemiology is, right? It's really just a big word for the science of studying patterns of health and disease in groups of people. So doing this work at a population level means like instead of just looking at one particular patient, we're looking at large groups to figure out why something is happening. So in the colorectal space, we're looking at these large groups of people to figure out why some people are developing colorectal cancer and why others aren't. So we look at things like what we've been mentioning, lifestyle, diet, environment, medical history to kind of gather a better understanding. And the tools of epidemiology are basically like the surveys, the questionnaires, the registries that we have, and the different data systems that collect all of this information. But the challenge that we're seeing and that we've kind of touched on is that globally, everyone collects this kind of data a little differently. Essentially, we're trying to collect the same, and we all understand what we need to collect. But because of those different nuances, it makes it really hard to compare across studies and combine data from different countries to gather that understanding globally. So in Barcelona, one of the biggest takeaways from our session for epidemiological tools was the need to standardize these tools and to create a common set of questionnaires and data collection methods that can be adapted across countries and across languages, across cultures. And by doing that, we can build a global master list of data essentially and fill in the gaps in what's missing so that we can make it just easier to pull that information together. So that's how we'll start to be able to see bigger patterns and get closer to understanding what's driving early onset CRC across populations.
Well, that's wonderful explanation. Also very exciting to hear because if you don't have, to your point, it's like apples and oranges, the same thing there, then it's hard to be able to give enough power and emphasis to what you find at that work group alone is going to make such a huge difference.
Oh yeah,
Um,
absolutely.
for early onset colorectal cancer. And for Andy, I know you led a really extremely interesting session that I'm sure was very interactive. What are some of the things that you discussed there in the
Yeah.
session?
So I think this was an interesting, multifaceted sort of discussion because I think even coming in the meeting, I'm a screening person. So I'm just going to say this at default. And we screening people like to talk about screening, and we can really completely sabotage any meeting to talk about screening. And so I said, screening people, let's not sabotage this because we need to talk about the it and the what and the how. So I just might say that there is a very, very a passionate man who I have literally come to really like working with from Australia, who really, I think, urged and said, let's talk about that role of stratifying for screening or stratifying for messaging or stratifying for whatever intervention, right? Because hopefully, there's new opportunities with the blood test, with all these things to stratify, to do something quick and early for these people who we know are just going to be in the precipice of a diagnosis, to get them in earlier, faster, quicker with, as you said, cutting edge opportunity. But there's things about when we get them in, I think can also speak to what the etiologic it was. And so we found this amazing way throughout the conference to say, fine, we will have a discussion about screening, but it'll be in light of what do we do for risk stratification. And so, that conversation was fascinating, right? We had, it's just, people from all over the world talking about what does stratification mean and what does risk mean. But we kind of came to a place where even just having consensus to say it's not about the intervention, it's not about the message, it's about risk stratification. That was huge, right? Like it was super cool. And then, I would say what came out of that are these, what I said, like, what are the ways that we can identify early interventions? Who do we identify for those? And what can we tell about the science of the it and the why and the etiology? There's also discussions about we have to do more as it relates to messaging to the public as well as to the provider community about what risk stratification means because we really have to do that because for this subset of the population, right, that we're learning more about the it and the what, we have to also be identifying who those folks are for something here and now so that we're doing it simultaneously. And so that was fascinating. I mean, we had Mexico, I'm just thinking around the room, right? Like it makes me think of that Daft Punk song Around the World, right? Every time I think about this, like walk around and what it means. But I think what was interesting is like there were a number of scientists that's like, look, I've done a meta-analysis on this, but what I don't have is data from this information or this region. Let's start with what we have. build out the information on what risk stratification means, who are these populations, what are these interventions, and let's do it together. And I think, even what we've heard in post calls with Kiran's group and my call is that I think in our group is people are saying, yes, but, right, the United States, the UK, Australia, there's those of us who've been doing science, like with population based opportunities and publications and rigor. There are a lot of communities all throughout this globe who don't necessarily have a place to put their data and their information and how they're doing things in such a scientific kind of rigorous or commonplace. I think the one resounding thing around all of these work groups is that's great and we can start with what we have, but we really need those global folks to tell us what they're doing and how they're doing it, because there are some innovative, brilliant people who just don't have the infrastructure the way that many of us do. And so, I think that was kind of a resounding thing, like keep it global. Global means getting the right people to the right place. And we're not all starting from the same sort of place of science or infrastructure to be able to do that. But brilliant people, brilliant minds all over this planet. And some of those things that we might know about might not, or might really be kind of the way that we go, because that's maybe what we need to do. So I think that was what was cool about these discussions too.
Extremely cool, because I think a lot of people don't think about that. They just assume the infrastructure is there and
Mhm.
that there are certain ways to go about, certain common pathways to go about the research. So I'm sure, no, that's absolutely fascinating. And in this particular case, with when it comes to early onset colorectal cancer, there's so much of a need to use, to build on what you know, but then to think outside the box as well. To a degree, it must have been fascinating to talk with all of those
Yeah.
researchers.
And the one thing I'll say is this is like, I also think there's some interesting things like in rural and frontier communities all
Mhm,
throughout United States or North America, Canada. Uh, some of the things that I think we see as disparities in research and opportunities, they're not
mhm,
so far from, I think, what many developing countries or people. So, I mean, there's interesting things on some level is there's parts of the countries that are doing things. There's
mhm.
parts that there's medically underserved areas, medically underserved scientists. I think, quite frankly, I've never really said that term, but I think clinicians and scientists who work in those areas that even within the United States, even within Canada, within the UK, there's areas where I think that we need to really think a little bit about how to bubble up best practices and have them part of the conversation in a bigger way and raise the playing field, for countries that are emerging or developing countries as it relates to infrastructure. But there's parts of the United States we need to do that as much at home as
Oh,
abroad. And that's why, like, all ships rise. Like, let's do it together. So hopefully all of the lessons learned can really elevate.
excellent points, and I think those are some things that, people haven't thought about before that you just brought up, really, that were taken away from there, and very interesting, and you're right, it depends on which part of the country. There's
Mhm.
some very big differences. And far as next steps, what are some of the next as you walked away, you ended the first in-person, I should say, meeting. I know there'll be many other follow-up meetings, but of the global think tank, what are some of the next ambitious steps that you are working on with fellow researchers globally to kind of put into action what you walked away with from this initial meeting?
This is the hard part, huh, Karen? The fun part, no.
Yeah, I think like we said, the work didn't end in Barcelona. Like it really
Yeah.
began there, you know. The work groups they'll will continue to meet over the next 2 years, where it'll continue to kind of align efforts, share resources, and figure out ways to advance the projects that were set and kind of the plans. We were, I said this earlier too, like laying down foundation, but now it's really about
Mm,
building from that. The ultimate goal is some kind of unified strategy that identifies the causes and saves lives under 50.
mhm.
That's my short and sweet take. But yeah,
Well,
it's a
It,
beast.
it is a
yeah.
beast, and I'll tell you because I think doing things globally and internationally, Kieran is up at 4 a.m. for our phone calls, and she's on Pacific, and I'm Mountain, right? And it's 4 a.m.
Yeah.
for her, and it's 5 for me. And, in Australia, if we do this, we can get Europe on. It's 10 or 11 o'clock at night, and I think one of the things that I'm going to just remind people is like, this isn't easy. I mean, people have families, people have schedules, people have a lot of things to do this. It is a commitment. I mean, managing time schedules, managing travel, managing whatever, but it's going to have to be what's going to be done to like keep the drumbeat going. Kiran and I are already set to go to Montreal into December in a meeting with our meeting leads and take this data. I got invited to a national colorectal meeting to talk about what are we using from this. We're already thinking about how we're going to meet, some of these investigators. But I think what we're also really interested in is also like looking at the bench, right? Like who's on JV, right? Who's on B team? Who's like not like in the prime of their careers. Like, who are we going to really compel to come do this work with us? Because,
Mm,
those are some of the things I think we're really thinking. But as Kiran said, each one of these work groups, they have work to do. It's all bubbling up to a whole. It is speaking globally, like actively making sure global representation is there. It's full time. I mean, this is a big gig for the next, we've talked about it's now 21 and a half months, right? But months fly. And so we got to
yeah,
get some stuff done. 2 years from now, or, whatever many months from now, in 21 months, we will be back together to say, like, look, this is the progress, this is the plan. Where are we moving now and what's next? So Fight CRC is going to keep that drumbeat. But I think the other thing is it's going to be one advocacy group with many tentacles that have derived from this sort of piece. That's part of it as well. So this podcast, honestly, is part of the plan, right? Like we got to get out the information and like people know how to join in, how to support the work. That sort of thing's happening. I think Fight CRC is in a 20-year history or 20-year anniversary, right? And it's really
yeah.
talking about hope. And it's really talking about what this is. Hope is every day meeting and seeing the potential. And I think this is like an initiative in these work groups. Frankly, like that's the next step. It's like finding hope for researchers and communities so it doesn't impact young people the way that it is now.
Absolutely. And we're happy to help get the word out as much as possible and thrilled to be able to do that with both of you on the podcast. And as we wrap up our episode, what are your hopes for the future of the global think tank on early onset colorectal cancer, and how can people connect and be supportive and help?
Love to start because I love that you had started to say hope. And
Yeah.
what's funny is that the very first project that I was talking about that was drove in peer education was Project Hope. It was UCLA Hope, stood for Harnessing Online Peer Education, and the word hope means so much. And I love that that was the acronym, and I love that this is where we're ending, and love all of these connections because yeah, my hope is that we continue to build a global community where collaboratively we are recognizing the problem together and we're acting on it together. You're asking how people can connect to us. Another great thing I mentioned earlier off before the podcast is that we launched a newsletter today, from our research advocacy team at Fight CRC. But people are welcome to connect with us through fightcrc.org. Subscribe to that such newsletter. It's our clinical trials newsletter. It's called More Time, More Options. Um, but it's a great way to kind of keep up in like in the know with clinical trials, but also everything kind of research advocacy space oriented. So you'll get the updates about what's kind of going on with the work groups and where we're moving and what's how we're inching closer to our 2-year mark. There's you're welcome to join us and be able to donate and really join in this fight against colorectal cancer. So, yeah, Auntie, please try to top me there.
But I'm not going to try to top. I think though that one thing I think I'm excited about is, these connections and building this network. It's, we have a 2-year strategy to do dedicated work around the priority research aim. But, I think it would be my goal, right, that with all the infrastructure and what we're building out, that this lasts beyond 2 years. But these networks and like creating something like this, that it lives in perpetuity. And I think that's going to be really the name of the game is like not just this specific thing, but this is a launching opportunity. And then, again, that it'll continue. But building networks and things of this nature, it's not easy. Getting people to like buy into something like this, it's a huge first step, but it's a necessary first step to like build bigger and better things that are going to come.
Wonderful. No, absolutely wonderful. We are so grateful for your work. So grateful for this global think tank. I can't begin to tell you. We have just met so many people, both Julie and I, on our journey with YMyHealth, whose lives have been affected by early onset colorectal cancer. We are so hopeful that with all of your global partners that you can find, the main causes, and we can, you can investigate some of the things that like things we've talked about on this podcast that have been considered to be the number one cause, but they weren't the only cause, to figure out why these numbers are rising, and also what we can do to navigate our own healthcare in this space as these numbers continue to rise. So we're very, very, very grateful for what you do. So thank you so much, Andi and Kiran, for joining us on the podcast.
Thank you.
Yes, thank you for having us.